causes more than 480,000 deaths each year and claims more lives than HIV, illegal drug use, alcohol use, motor vehicle accidents, and firearm-related incidents combined. Did any of you guess cigarette smoking? Probably not. As a registered nurse, I have seen too many people suffer at the hands of cigarettes. Not only does cigarette smoking have detrimental health effects, but also causes social, mental, and financial strain. Today I'm going to talk to you about smoking cessation. I will provide you with alternatives to smoking, and I will enlighten you to the wonderful benefits of a smoke-free life. Many people use excuses as to why they choose to smoke. For some it is stress relief, and for others it is a result from PTSD. We also have those individuals that smoke recreationally or for pleasure. Whatever the reason they choose to smoke, there are many more reasons as to why you should quit. According to smokefree.gov, one of the first steps to quitting is to figure out why you smoke in the first place. I am sure many of you have been told that nicotine is the addictive ingredient in cigarettes that causes the craving. About 80 to 90% of people who smoke become addicted to this powerful substance. Initially, people report feeling a buzz or a good feeling when they first light a cigarette. But once that feeling starts to fade, they may start to feel down or sad, have trouble sleeping or thinking clearly, they may be irritable or restless, and they may even start to feel hungry and gain weight. Those are symptoms of withdrawal, and they may be the biggest reason why people choose not to quit. They don't want to feel bad. However, I'm about to tell you just how bad smoking actually is, and if that does not motivate you to quit, I'm not sure what will. Instead of smoking, due to any of those reasons, try meditation or deep breathing to calm anxiety and stress. If that does not work, there are medications designed to help you to quit. Reach out to a support group or your friends for motivation and encouragement. Get moving and be physically active to distract your mind from the urge to light one up. I'm sure you've all been told at some point in your lives that smoking is bad, whether you're told by your parents or learned about the harmful effects smoking has on your body in health class. This may not be the first time you're hearing this. However, I'm going to tell you again. It is very harmful to your body and to your health. According to the CDC, 90% of lung cancer deaths are caused by smoking. Smoking alone increases your risk of coronary artery disease and stroke by 2 to 4 times. It also puts men at 25 times the risk for developing lung cancer, and for women the same amount. Even if you said to me, well, I only smoke a few a day, I'm sure I'm fine. Let me tell you, you are wrong. Even smoking fewer than 5 a day can have early cardiovascular effects. If you already have underlying asthma or chronic bronchitis, smoking only causes further damage to your lungs and increases your risk of an asthma attack. Smokers are 12 to 13 times more likely to die from COPD or chronic obstructive pulmonary disease than non-smokers are. Not only does smoking cause devastating effects on your heart and lungs, but it has quite the negative effect on other areas of your body. Did you know that smoking causes cancer almost anywhere in your body? Think of your bladder, your cervix, your colon, rectum, esophagus, kidney, liver, pancreas, and stomach. You could look at it this way. If no one smoked, 1 in every 3 deaths from cancer would not happen in the United States. If none of those facts alone do not urge you to quit, perhaps the lives of your future children would. Smoking can make it harder for women to have a baby or become pregnant. It can also affect the baby's health before and after birth. Smoking increases the risk for stillbirth, preterm or early delivery, low birth weight, sudden infant death syndrome, and orofacial clefts in infants. Smoking also causes a reduced sperm count in males, which can reduce fertility and increase the risk of birth defects and miscarriages. Additionally, smoking also causes harm to those around you through exposure of secondhand smoking. According to WebMD, smoking increases your risk for developing blindness, rheumatoid arthritis, type 2 diabetes, and tooth loss. It also causes inflammation and decreases your immune function, making you more susceptible to infection and disease. Nearly $170 billion is spent on direct medical care for smoking-related illness in the United States. According to smokefree.org, someone who smokes a pack a day spends about $160 a week on cigarettes, which adds up to nearly $8,500 a year. Just think of the amount of money you would save if you quit and all the activities you could do, places you could visit, and memories you could make if you chose to quit. So now do you think you're interested in quitting? Quitting cigarettes reduces your risk of cardiovascular disease within just 1 year after you stop. Within 5 years, your risk of mouth, throat, esophagus, and bladder cancer drops by 50%. Smoking cessation is associated with the following health benefits: reduction of respiratory complications, heart attack and stroke, lung cancer, infertility, and other conditions such as rheumatoid arthritis and diabetes. Overall, your goal is for a healthy, better life. Smoking cessation will not only save you money, but it will save you time. Years of your life you would have lost if you continued to smoke. It gives you more time with your family, your friends, and to do things you want to do in your life without suffering from conditions related to smoking. Say no to smoking and say yes to a healthier future. In my poster, you will see healthy lungs versus infected lungs from smoking, and as well as motivational pictures to urge you and promote you to quit. All the information I got from these websites. Thank you for watching.